Go.
Hello, I'm Dr. Omar Bey of ObeyYourDoctor.com, and we just did a TV show on stroke. Stroke is so important because so many people are affected by it. The TV show is called A Moment in Medicine. Well, we had Dr. Nelson Aluya on our show, and he gave us a full understanding of stroke. I have Dr. Aluya here, and Dr. Aluya, tell us something about stroke so that all the people out there can know something, what we talked about on our TV show. Yeah.
Well, stroke is a severe chronic debilitating disease that can affect anybody from any race and any age, male or female, and it's the fifth leading cause of death in America and the second leading cause of death in the world. So in the world of stroke, time is of the essence. Time is stroke, time is tissue, time is life. So if there's signs or symptoms of a stroke, where we talked about, fast,
Right.
face for F, you recognize if there's a drooping portion of the face, you ask them to smile. As one portion just drops, those are the early signs of stroke. We talked about A, which is the arms. Raise both arms. As one drops down, that's another sign of stroke. We talked about S, which is speech. If they have a slurred speech, that is another sign of stroke.
Right.
And T for time and telephone. You pick up the phone and call 911 because every minute that goes by with a stroke victim, 1.9 million cells die. And it affects over about 800,000 people in the USA today, of which 144,000 people die from strokes every year.
Right.
So time is of the essence, and if you find out that somebody has stroke, you intervene on time, you have a 3 months less debilitating time to spend when you have a stroke symptom.
Right.
So
Right.
time is
Time
much
is
important.
important.
And then recognize the risk factors for stroke, which we talked about, age. It's important. It affects every age, but
Right.
the older you go, the older you become, the higher the risk of you having stroke. Strokes do happen, of course, in the younger age group, especially in African American kids with sickle cell disease.
Right.
And of course, with those who have lupus, it can give you a risk for stroke as well. We talked about obesity because the obesity gives you 4 times the risk of hypertension and stroke. If you also have hypertension, it increases the risk of stroke.
Right.
We talked about race. Unfortunately, African Americans have a 2 times increased risk of having stroke than any other race. So it's important. All the debilitating effects that come with it affects African Americans even more. Studies actually showed that the death rate for stroke over the years has actually decreased. Unfortunately, hasn't decreased a lot, except for the Hispanics.
Oh.
So it's really important that we share this message and share the message of stroke and go tell family members, tell them what have heard today about stroke so that people will begin to take time and take interventions about stroke.
Excellent, excellent. Well, the thing of it is that you said something about weight, and that's I'm pounding about people about weight and trying to get them to understand that they have to be closer to their ideal body weight.
Right.
Then we have the website, Obey Your Doctor, and go to that website because guess what? It has so much information on there as far as health, as far as nutrition, and as far as weight loss is concerned. So go to the website, Obey Your Doctor. Alrighty? And listen, stroke, take heed. Make sure if you see signs, call 911. Alrighty, this is Dr. Omar Bey, and I'm signing off. And until next time, I just want to say peace to you all. All right, bye-bye.
Thank you.